Putting yourself into the future is an extremely difficult thing to do. We can all see where we are at the moment, what our problems are, and how things might change. But changing our mindset to produce a picture 20 years hence or 30 years hence is extremely difficult. My name is Pali Hanjin, and I'm the convener of the Changing Face of Medicine project at the Academy of Medical Royal Colleges here in London. Changing Face of Medicine is a commission set out by the Academy of Medical Royal Colleges. The purpose of the project is to look at the various challenges that we are likely to face over the coming years in light of the difficulties which we have at the moment, and to see whether we can visualize what the future might look like. Because we need to be able to demonstrate to our medical colleagues that we are thinking not only about the problems that exist now, but how they might evolve and how things might look in the future. We have a group considering the impact of technology, artificial intelligence, and all the other new sciences in this particular field, and how these are going to impact on doctors and the public over the next 10 or 15 years. We're aware that shifts in technology are going to be not just challenging for doctors, but may well change the nature of the way medicine is practiced. Some of our other theme groups are working on the patient-public-doctor relationship. The apostolic, patronizing approach of the doctor has not been valid for many years. People who have problems have every right to feel autonomous, and that when they consult a doctor, not only are they looking for someone who can be efficient, and confident, and deliver care in the right way, but also that they want to be a completely equal partner in the way decisions are made about them and how they can influence their own lives for the better. In addition, we are keen to look at the way undergraduate medical training works for doctors. The big question that arises is our current medical education, our training programs for young doctors, are they suitable for the future? Or are we actually working within a model that was developed a long time ago? And is this model proving to be quite difficult to change? How can we bring about a change that makes our doctors fit for the future? Some people have asked whether doctors will exist in 25 years. And that's not an unreasonable question. You might argue that with technological shifts and increasing levels of specialization, that there may be a variety of other professions or other people, other healthcare workers who could do the job that a doctor does. You might argue, for example, that a highly specialized surgical procedure performed using sophisticated machines might be done by someone who isn't necessarily medically trained, but is trained in health, or is trained specifically to do that job. This calls into question, therefore, as to whether the existing picture of the doctor will even apply in a few years' time. It is not surprising that many doctors feel somewhat lost in terms of their vocation. High-level pressures of work, high levels of demand, the fact that they're working within a corporatized system with financial issues to be taken into account when taking care of patients. Doctors are no longer necessarily wanting to work full-time. They feel that the pressure and stress of their job is difficult for them to bear. There's a shift towards early retirement from people who feel that the system is such that they're unable to perform as well as they want to. Medical advances have meant that we have a great deal more knowledge and a great deal more science that we have to work our way through. The level of expectation that our patients have of medicine has gone up enormously. All these factors put together mean that doctors are under a great deal of pressure, and some would argue that it's very difficult for them on a daily basis to continue to perform to a level where they feel that they are doing a very good job. If what I'm saying sounds negative, it's not meant to be. The purpose of the project is to accept the difficulties that we face at the moment, and then to visualize the future with a view to becoming better prepared for the changes that are arriving. And here we are in the Wellcome Collection in London, and as we look around, you see evidence everywhere of the adaptability of societies and of medicine, of doctors, the way things have changed and evolved. There's no doubt that we can do so again, but it's important for us to be aware of the shifts that are taking place and to be prepared for them.
The Globe Advice oversees ਐਜੂਕੇਸ਼ਨ ਤੇ ਇਮੀਗ੍ਰੇਸ਼ਨ ਕੰਪਨੀ ਹੈਗੀ ਹੈ। ਸਾਨੂੰ 35 ਸਾਲ ਦਾ ਐਕਸਪੀਰੀਅੰਸ ਹੈ। ਅਸੀਂ ਬੱਚਿਆਂ ਨੂੰ ਉਹਨਾਂ ਦੇ ਪ੍ਰੋਗਰਾਮ ਸਿਲੈਕਸ਼ਨ ਤੇ ਸਕਾਲਰਸ਼ਿਪਸ ਵਿੱਚ ਹੈਲਪ ਕਰਨੇ ਆ। ਅਸੀਂ ਬੱਚਿਆਂ ਨੂੰ ਅਪ ਟੂ 50 ਲੱਖ ਤੱਕ ਸਕਾਲਰਸ਼ਿਪਸ ਲੈ ਕੇ ਦਿੱਤੀਆਂ ਹੋਈਆਂ ਨੇ। ਅਸੀਂ ਤੇ ਬੱਚਿਆਂ ਦੇ ਵੀਜ਼ਾ LORs SOP 'ਚ ਹੈਲਪ ਕਰਨੇ ਆ ਤੇ ਪੋਸਟ ਲੈਂਡਿੰਗ ਸਰਵਿਸਿਜ਼ ਵਿੱਚ 에ਅਰਪੋਰਟ ਪਿਕਅਪ ਤੇ ਉਹਨਾਂ ਦੀ ਟੈਂਪਰੇਰੀ ਅਕਮੋਡੇਸ਼ਨ ਦਾ ਇੰਤਜ਼ਾਮ ਵੀ ਕਰਨੇ ਹਾਂ।
ਬਿਊਰੋ ਰਿਪੋਰਟ ਸਿੱਖ ਨਿਊਜ਼ ਐਕਸਪ੍ਰੈਸ। ਜੇਕਰ ਤੁਹਾਨੂੰ ਸਾਡਾ ਇਹ ਉਪਰਾਲਾ ਚੰਗਾ ਲੱਗਾ ਹੈ ਤਾਂ ਇਸ ਨੂੰ ਲਾਈਕ ਕਰੋ, ਸ਼ੇਅਰ ਕਰੋ ਅਤੇ ਸਾਡੇ YouTube ਚੈਨਲ ਨੂੰ ਸਬਸਕ੍ਰਾਈਬ ਕਰੋ।